Baba Black Sheep, and there was no dramatic improvement. So we did him with adipose, with PRP. Now he is walking around now. That's the one who was shot and then drove his car to the hospital, and it's good he's alive. 4 bullets went through his body. There are many stem cell failures, especially on the old methodologies. But the newer methods, you see the effect immediately in the first 1 week. For diabetes, like magic, within 1 month, wala nang medicine. Yeah, that's a very good question because it's very good for autism, cerebral palsy, spinal cord injuries, dementia, Alzheimer's, and even brain injuries and stroke. So, patient, aside from Banahaw, Spiritista healing, well, you can do stem cell. Well, that's a very good question, because we do banking. Now, we do banking for those with multiple concerns like diabetes, hypertension, erectile dysfunction. Kapag marami masyado yung concerns nila, we would do banking for 3 sessions, normally 3 months apart. But those who are ambulatory with no concerns, between 40 and 50, that's the best age to do stem cell. They feel young, act young right away. They sleep well, and if you ask them, especially the past presidents of the Philippine Medical Association, kasi most of them have been stem celled already. One of them has a sugar that is always 200, not controlled by oral meds and insulin. And one day I met him there in Manila Hotel, and what did he say? Doc Chris, my sugar is 94. I said, what's fantastic about 94? He said, do you know that I did not tell you that my sugar, the lowest is 200? Ngayon, 94. And he's not on medicine. So, we're happy that it's really working with us, especially those who are taking maintenance medications. That's a very good question, ma'am. Normally, we do it 1 time, because the effect is quite long, up to 5 to 10 years. But those with multiple degenerative concerns, we would rather do 3 sessions with them. By the way, the banking costs about 8,000 pesos a month. The best bank is here. Naintindihan nyo, ma'am? The best bank is here. That's why when we do you the first time, do not request for a major liposuction. Kasi yung mga babae, kapag nakahiga na, sasabihin, Doktor, baka pwede 3 liters tanggalin o 2.5 liters tanggalin. Sayang naman yung stem cells na itatapon natin. Well, remember, it's how efficient your body is. Ano ba yung metabolism mo? Are you hypothyroid or hyperthyroid? These are the things that you have to balance. Well, in the Philippines, we are loaded with the miracle tree, which is usually at the back of the house. It's called the lowly coconut. You know, it's thermogenic. If you take FCO, fresh coconut oil, or VCOs, which are quite dirty, if you take that regularly, you definitely lose weight. Definitely lose weight, because it's thermogenic. Meaning to say, even if you're sleeping, you're losing weight. And you look at your Lola or your great-grandmother when she was still alive. The hair is up to here, black at 90, very shiny. But nowadays, look at our hair. Wala na, ubos na ka sa shampoo. But during their time, my goodness, they look very, very young despite their age. By the way, there's stem cell also in malauhuging coconut. You know, the coconut that is just like soup inside. If you take that, that has also stem cell effect. Unfortunately, your stomach will digest that, and the effect will be much lower. So, anybody else has a question before we turn it over to the next speaker? So to recap, stem cell therapy is now available in several hospitals. It's available. There are clinics also who are doing it, but now the thrust is to do it in hospitals as much as possible. And of course, the accredited clinics. Be sure you know that who the people are behind and what is their technology that they are using. Is the technology accepted, and especially by the Department of Health? I believe that in the next 6 months to 1 year, stem cell therapy will become very, very cheap. Very, very cheap. But 6 months to 1 year might be a lifetime for other people. They might not reach that. So for those who you think needs stem cell therapy, tell them that it is available and it can easily be availed of. And you don't have to pay 4 million just to get the effects. You can get better effects even at just less than $1 million. Yes, yan ang primerong nag-i-improve, ma'am. Because once 80% kasi ng stem cell, we put it by IV, intravenous. Pagpasok sa heart, it will be pumped to the lungs. That's why it is sequestered. Most of them are sequestered in the lungs. That's why yung mga emphysema, atelectasis, bronchiectasis, they are improving remarkably with that. By the way, there's a specialist that clears our patients for surgery, for cardiopulmonary clearance. Yung doktor na yun, he's a pulmonologist, a very well-known pulmonologist in St. Luke's. He has bronchial asthma. Ngayon, ma'am, wala na siyang bronchial asthma. Kasi na-stem cell siya. Nagulat siya na wala yung bronchial asthma niya.
Sabi mo, sir, pa-clearance muna.
Kailangan.
Ano yung mga bagay na limitations niya na hindi ka pwede magpa-stem cell?
Well, number one is, kung hindi naman maka-stem cell yun. That's the number one limitation. Number two is people who are taking medicines for thinning the blood, like aspirin. Aspirin kasi, ma'am, pinaka-demonyo na gamot. 14 days ang washout, ibig sabihin, you have to stop it for 14 days before you can operate on the patient. Otherwise, they might bleed to death. They might bleed to death, including Plavix, lahat ng gamot na binibigay ng mga pharmaceutical industries to make the blood very thin. But you can thin your blood by just using Norwegian salmon oil with garlic oil. And if you are injured, the bleeding will stop naturally. So those who cannot undergo that are, by the way, ma'am, before we had strict standards. Now we're changing our mind. Because anybody